Lower cross syndrome is a musculoskeletal imbalance characterized by an S-shaped posture of the lumbar spine. The cross in lower cross refers to a metaphorical X placed against the pelvis and the lumbar spine. Each line of the X shows different muscles in the area. One line being overused are the lower back extensors and hip flexors, and is crossed with the other side that shows the muscles that are over-inhibited, the hip extensors and trunk flexors. Interventions for lower cross syndrome include strengthening exercises for the glute muscles and the trunk flexors, the abdominals, and stretching exercises for the low back extensors and hip flexor muscles. Leaving this postural distortion untreated can lead to postural changes such as anterior pelvic tilt, lumbar lordosis or hyperlordosis, lateral lumbar shift, lateral leg rotation, and hyperextension of the knee. All of these can cause tight and locked muscles that become painful and put pressure on your lumbospinal joints. The first stretch is a half-kneeling hip flexor stretch. The patient should have an emphasized posterior pelvic tilt in order to give the most maximum stretch possible for the hip flexor muscles. First, we're going to start off with single leg squats, 15 on each leg for one set. This is done by raising one foot while squatting on the other side. These are modified single leg squats due to the fact that the leg that is raised, the toe is pointed to activate the gluteus medius muscle as much as possible. If doing the single leg squat is too difficult, you can either use a chair or something to stabilize yourself while holding it, or you can use a bench or a chair to sit down at the bottom. The next exercise is a plank on the floor with your forearms down, making sure that the abdominal muscles and the gluteus maximus is engaged. There are several additional glute exercises, including seated abduction, lying abduction, hip extension or glute bridges, lying sideways clamshells, and standing walking abductions. All of these exercises can be done with a band or without one, and when performing them, the gluteus muscles should be engaged as well as the core.